Good morning, everyone. I'm happy to host you at one more Sailing to Lisbon webinar. These webinars are part of the promotion for the European Public Health Conference in Lisbon in November this year. We'll briefly start with the webinar, but I'd like to share with you a brief video of Lisbon, so that we can invite you to visit us in November. So here's the video of Lisbon. So hope this also is a good, some good ideas for you to visit us and stay a little bit longer than the conference in Lisbon. I'd like to say welcome to all the people watching on the different streaming channels. So we have Facebook, LinkedIn, YouTube, and X, the former Twitter. So feel free also to interact with us, posing questions, adding comments through the social media, and we'll have a short period of questions at the end. And I'll now introduce you to our moderator for today, André Peralta Santos. Welcome, André, and I give you the floor. Have a good webinar. Thank you.
Well, thank you, Ricardo. Good morning to everyone, and welcome to the fourth Sail to Lisbon webinar dedicated to artificial intelligence in healthcare. This webinar is part of a series of webinars in preparation for the 17th European Public Health Conference that will be held in Lisbon this November. To everyone watching online, I look forward to welcome you in person in Lisbon this November. So let's dive into the theme of today, artificial intelligence in healthcare. Artificial intelligence is no longer a concept of the future, it's here to stay, it's part of the present. And this week, OpenAI and Google presented their last iteration of AI assistants, showcasing how the technology is evolving very fast. As in healthcare becomes increasingly digitized, AI is already making a significant impact. It aids on screening, diagnosis, health system management, and looking ahead, AI has the potential to tackle some of the healthcare worst problems, like finding cures for serious illness, improving diagnostic access, speed and accuracy for detecting health threats, and preventing chronic illness, protecting against dangerous pathogens, and providing essential tools for strengthening healthcare workforce. AI is set to be a pivotal force for global health by enabling us to learn from cross-border data, to identify a diverse set of populations and help us to identify inequalities that drives healthcare system towards a greater resilience and sustainability, and hopefully move towards a more resilient and human-centered healthcare. As AI scales up in the healthcare market, we need a more nuanced policy response. We must understand that effectiveness and efficiency of AI solutions should be grounded on ethical and sustainability perspective. AI is already transforming the healthcare workforce by providing more time to patients. Moreover, AI can unlock an immense value from the vast amounts of health data that is currently not used. With timely access to quality data, AI can do much more, ensuring the appropriate protections are in place. As AI continues to revolutionize the healthcare industry, we must address important questions about the impact on healthcare workforce, the risk of misinformation, and the need for a robust regulation. Well, to address all those challenges, we have a spectacular set of speakers today with a vast knowledge in the area. Our first speaker is Professor Anna Odon, the president of the EUFA Digital Health Section. Anna is a full professor and director of the School of Public Health in Pavia, Italy. She is a member of the Italian Supreme Health Council, a medical doctor by training, received a master's in epidemiology from LSHTM, and a master in health policy management from Harvard School of Public Health. Simon Piatek is a digital lead of the Vaccine Confidence Project at LSHTM and includes social network analysis, fake news and disinformation narratives from the OSINT. Simon has expertise in understanding and working in social media platforms relevant for ECA region, as well as proven expertise in monitoring analysis of social media interactions in local languages. And finally, Ricardo Batista Leite is the CEO of Health AI, and Ricardo unfortunately could not be present here today, but he has a video to show us. Ricardo is a Portuguese-Canadian medical doctor trained in infectious disease and has an extensive experience in global health systems, science-based policy making. And prior to his role as CEO of Health AI, the global agency for responsible AI in Geneva, Ricardo serves as a member of parliament in Portugal for several terms. So I welcome and thank you all the speakers. Each of the speakers will have around 10 minutes. And our first speaker is Anna Odon, that will elaborate on how AI impacts on the healthcare workforce. Anna, the floor is yours. Thank you.
Thank you very much. Thank you very much to Ricardo and Andres for organizing this webinar today. I like very much the idea of sailing to Lisbon. That sounds really exciting. And I'm also excited to be here with the colleagues and experts talking about AI. The focus of my brief presentation will be around the potential of artificial intelligence to support education. I would like to put my slides on. Thank you very much. So I'm being here at the university and having to deal with medical students, doctoral students. We have been exploring the potential, but also the barriers in applying AI-based tools to support education in undergraduates, but also continuing education for the healthcare workforce. So to start, let's say that the idea of applying artificial intelligence to medical education is not new at all. You can see that earlier in the 70s, and I'm not joking, in the 70s, some studies from Canada, and I'm citing Canadian doctor short-lived that published back in 1978 computer-based medical consultations, already looking into how what was not called artificial intelligence at the moment can support medical education, taking into consideration how fast medical education and medical technology was progressing. So it's a long story, but now, of course, it's, as Andrea was saying, AI is becoming more and more part of our lives. So it's important to see how it can support medical education. This is a timeline derived from a scoping review published in 2020 that sets what were the main milestones in research on artificial intelligence applied to medical education. If we had to identify which AI use and which AI components can support medical education, I mean, we can cite, for example, virtual patient simulations. We can think about how to personalize learning platforms. We talked about data analytics, clinical guidance for doctors, but also for medical in training, for trainees, performance analytics, sentiment analysis and bias evaluation in patient-doctor relationship, predictive models for diagnosis, treatment, and rehabilitation, but also in the context of public health, procedural guidance for trainees, for example, directors for learning a skill. We mentioned chatbots, we mentioned data labeling, and we mentioned content generation for curricula, but also summative assessment completion. So how AI can support grading and the teacher side of education. So the AI use cases in healthcare education have been categorized in these papers, the references showed on the slide, into four different chapters, into four components. We can think about student teaching and student supporting. So what authors called in an instructivist approach or a constructivist approach, with the former referring to tutoring. So intelligent tutoring systems, including automatic question generations and brain-based teaching, for instance, while the idea of AI support, like a constructivist approach to AI use in medical education from the student's perspective, refers to more like, for instance, formative writing evaluation, learning network orchestrators, language learning applications, and so on. On the teaching side, on the other side, AI has the potential to support, not to substitute, but to support faculty in, for instance, student foreign monitoring, teaching assistance, automatic test and content generation, automatic scoring, but also in research, in graduates and in graduate studies, plagiarism detections, and also student attention and emotion detections to support also the emotional part of the learning process. On the fourth component is the system supporting in general, and we refer to, for instance, educational data mining for research education, diagnosing learning needs, but also learning difficulties, and then AI as a learning research tool. This is just a very, very theoretical framework, which is important to kind of categorize the directions in which AI can support medical education. But of course, we have to mention, although we stay in a very model-based and theoretical-based approach, which are the opportunities, but also the challenges in walking that path. And in terms of opportunities, of course, there is the great potential of customize and personalize the learning experience, personalize assistance to medical trainees and doctors, automated grading and interactive feedbacks, which is more cost-effective and timely, simplifying complex medical concepts, simulated clinical scenarios, very quick and very easy to access, integration with the virtual reality. I mean, all sorts of things that can improve diagnostic accuracy in the long term, informed clinical decision, create efficiency on, for instance, repetitive tasks, with the overall aim of improve patient safety and patient outcomes. On the other side, we know there are challenges, and some of them not really explored in full details. So if we think about the examples that we have of AI-based methods to support medical education, we can think about lack of, for instance, face-to-face interaction, what authors call the humanizations of the approach to patients, lack of emotional intelligence or empathy, or even more threatening, the detracting from critical thinking skills in the learning process, but also in medical practice. And then we know there are all sorts of pitfalls and challenges with reference to how not well AI systems work, and we refer to inaccurate results from what they are called in the AI vocabulary hallucinations, or unintended reinforcements of biases, so something which is not true and can be learned and taught. And then we have challenges with reference to privacy and security concerns, limited. I mean, not in every context and every settings we have access to technology and AI, so that creates a case for inequalities in getting benefits from the application of AI to medical education. So there are studies already mapping the distribution of educational disparities when applying AI in different settings across Europe, but also the globe. And then there is this cultural need for shifting towards a new approach to education, because this is the topic of our presentations, but to medical practice in general. For those of us who are physicians, we are perfectly aware of the fact that our role has been profoundly modified by AI, and we need to understand how to have our role supported by AI, but not replaced. And this is a process that we can walk smoothly across with the support of training and education at different phases of our career. To mention, when we refer to challenges, also the ethical considerations around the applications of AI-based tools to education and to medical practice. And I'm glad that it has been mentioned in the introduction, the European Commission Artificial Intelligence Act, that tries to identify, but most importantly, to tackle the ethical considerations that are posed by the use of AI in the medical field and in the big arena of patient care. The state of the evidence, to be honest, is extremely is exploding, but our impression, our opinion is that there is still a great amount of evidence that needs to be acquired and consolidated in order to feel confident in using AI in medical training. This is one of the few systematic reviews available on artificial intelligence for healthcare and medical educations that highlights how evidence is accumulating, but also highlights how the quality of this evidence, I has some pitfalls, and so the strong need of allocate resources to further produce evidence of quality in AI applied to medical education. And it's a very interesting reading if you are interested in that. We have now listed a couple of practical examples of original studies that has proved AI-based interventions in medical training to be promising or efficient in improving knowledge of medical students, but also young doctors and medical trainees. You can see, for instance, this study is a Chinese study published in 2022 that reports on the development of AI Teach, which is a virtual case learning system that uses natural language processing and hospital medical records to achieve improved clinical thinking ability in young doctors through a self-service trial and error approach, which has proved to be particularly beneficial in situations that requires for instance, social distancing and also the need to reduce costs in medical education. So you can see that the interventions prove to have a significant impact in improving 5 indicators of clinical thinking evaluated in a relatively small sample size on medical trainees. And this is one example. We have mentioned a second very different examples from Japan. This is a Japanese study that built skills assessment system that provided objective feedback to surgical trainees by analyzing the motion metrics of laparoscopic instruments during tissues dissection. Using what authors call the motion capture system and machine learning algorithms. The results, to keep it very short, suggest the potential for enhanced feedback and training in the specific case of laparoscopic surgery, which is promising, and authors conclude by saying that there is great potential of applying this AI-based tool in education of young gastric surgeons. A third and last examples, which is more aligned with our public health expertise, is related to the Irish artificial intelligence-based system called SureWash, which is developed for automatic hand hygiene training. I must admit that the literature on the application of AI to support hand hygiene is quite broad and accumulating. SureWash demonstrated a good diagnostic capacity, but most importantly, and you have 2 outputs from 2 different studies on screen demonstrating that it has the potential to increase young professionals and healthcare workforce compliance to proper hand hygiene, which we know is a key instrument for quality in healthcare and patient care. It has been very, very short because we had 10 minutes to present, but hopefully we'll have time to discuss at the end of the 3 presentations. I'm just listing for discussion some recommendations. I mean, from our experience, which is derived from what we know from the literature, but also from our research, there is an increase in AI knowledge and ethical use, but the evidence is accumulating. We still need, and this is a call for allocate more resources on multidisciplinary research in quantifying the true impact of different examples that have been implemented across the world of intervention using AI in medical education, so collecting quality evidence, ensuring transparency in the development of AI systems in medical educations, the need to address biases in AI algorithm to ensure what we call a fair representation of educational content, the need to validate the outputs generated by AI education tools to ensure the accuracy and credibility of information, but also the potential of scaling up or transferring models applied in certain settings to other settings. So best practice sharing. There is a need to prioritize privacy to protect student and patient data, plus obtaining informed consent from students regarding the use of AI technologies in educational processes. And of course, and this webinar is a good example of that, fostering collaboration in different disciplines. And I'm talking about AI experts, but also educators and the biomedical fields and students to bring diverse perspective and expertise starting very early from graduate studies on. We have some experience here at the University of Pavia of integrating AI content into medical education, starting from medical schools, which sounds really promising, but we must admit that we are at a very early stage of using AI in medical education, at least in our setting. With this said, I remain available for the discussion, and I thank you all for your attention.
Well, thank you, Anna. That was a great presentation. You give us a great highlights of the potential of AI in medical education and to transform the future healthcare workforce in Europe. I would like to welcome everyone that joined us since the start of this webinar, and encourage you to post comments, questions, whatever you like on the comments section to make this more interactive and fun. And we will pass to our next speaker, Simon Piatek, and he will give us some food for thought around the challenges of AI. Simon, the floor is yours.
Thank you so much, Andre, and hi, everyone. Oh, you can see my presentation. Excellent. Before I start, I just want to say that the video of Lisbon that you showed us right at the beginning was great. And all the images were the real images. None of them were misinformation or AI generated. I was there last year, and it's a beautiful city indeed. I highly recommend. I'm here today to talk about misinformation in AI. So I'm Simon Piatek. I'm at London School of Hygiene and Tropical Medicine, and I've been studying misinformation for the last 15 years, 5 years, in the context of public health at London School. And today I want to talk about maybe not so much misinformation, but the trust or erosion of trust online that misinformation creates. So for the last 5 years, we have been looking at images like this. And right at the beginning of the pandemic, back in 2020, people were not too sure if they're actually relevant, if they make any difference. A lot of people, especially academic circles or policymakers, thought these are just funny images online. They don't really make any difference. Who would even care? It's just a joke. Well, we decided to test this. So back in 2020, we conducted a nationally representative study in the UK and in the US, just to measure, to see the impact of such images. And it was a very simple design. We asked people about their willingness to get vaccinated when the COVID-19 vaccine becomes available. It was pre-COVID vaccine. And then after that question, we showed them examples of misinformation that was in one group, and then obviously examples of correct information that we identified online in the other group. And then we asked them the same question again about their willingness to get vaccinated. And here you can see the results. In the UK, 6.2% drop, and in the US, 6.4% drop in their willingness to get vaccinated. These are the people who said they would definitely accept a COVID vaccine. We then digged a bit deeper to see what type of misinformation has the real impact, and we identified scientifically looking misinformation as the one that really increases people hesitance and makes people to think twice or change their mind. Those figures, 6.2%, 6.4% for this audience, I don't have to explain so how significant that is if you're trying to get the population vaccinated. So based on those numbers, we also thought, why don't we have a look at the public health systems in Europe and to see if they are ready to combat this infodemic of misinformation. And so we conducted this study that is with UNICEF in a lot of European countries, predominantly down south, starting from the Balkans, but going as far east as Kazakhstan. There were 16 or 17 countries. And we asked them if they feel, and these are ministries of health in those countries, we asked if they feel prepared. And these are the responses that we got. The people, 51% of the people said that they don't have skills or knowledge how to use, how to identify, how to deal with misinformation and social media. 31% said they have no software, no tools, and or organizational capacity. That was 21%. So the picture of us as public health communicators and those who are making those decisions, policymakers, but those also who are dealing with this problem online, clearly we have an issue. But also in academia, we formed this coalition of academic partners, including Cambridge and Harvard and Rome and Venice and City University in Britain, to study the impact of misinformation. And we just realized that increasingly with time, starting, say, in the last 20 years, back in 2020, as academics, we're increasingly getting less and less data to be able to analyze what's happening, for example, on Twitter or on Facebook. It's basically, this is what's happening with these platforms. And that sort of creates the situation that as academics, we're not able to verify what really makes the difference. So the picture back then in 2022, it wasn't looking really good. And then end of 2022, something really significant happened. ChatGPT was launched. It was a true game changer. And I think now, a year and a half later, we can say that the information landscape will never look the same again. Here we can see how quickly ChatGPT, in comparison to other social media, not just social media, but the main sort of platforms that we're all using online, how quickly it gained the first million users. It took just 5 days. And today, ChatGPT has almost 200 million users in just over 1 year. So this is how quickly this technology is being is actually growing. So today, I really want to focus on 2 things. The first of sort of reasons why we really care about AI in this social media landscape is because it makes it extremely easy for people to produce misinformation. If we're thinking about the sort of last 20 years and social media times, you would still need to make some effort to produce misinformation, either to write an article or to produce a video. You need to record it, or if you could steal it online from someone, but you need to edit that video. When it comes to images, you need to have some skills to edit that video, to produce, for example, one of those images that I showed you at the beginning of the presentation. With AI chatbots and AI in general, like, you no longer need to be an expert. Anyone could produce misinformation, which means it's extremely, extremely easy. And in these sort of what we call social media times, sort of pre-ChatGPT, these were normally organizations that were responsible for production of the majority of misinformation online. We believe that with the new environment and with the AI being available to everyone, it could be anyone that's producing misinformation. There's no more any entry barrier there. So that is the first significant change. And the second one, which I personally believe is even more significant, is that AI chatbots will completely change the way we search. So for the last 25 years, we've been used to the search that gives us options to choose, especially when it comes to search results. So you would search on Google for whatever, and you would get those 10 links that you could follow, you could read, you could educate yourself. You would search on Facebook, and again, you would either get a list of profiles or a list of posts or a list of pages that you could go to and educate yourself. The same on Twitter. You search for anything, say a headache, and then you've got a list of posts. As public health specialists in communications during the pandemic, we would use these platforms whenever people were searching for a COVID-19 vaccine, and we would make sure that the correct information about the vaccine is always there somewhere close to the top, so that people have got access to this correct information about the vaccines. With the emergence of chatbots, this will change forever. Chatbots do not really give you an option to choose. You ask the question or you enter the keywords and you get the answer. It's not that you can educate yourself in a way that you have a choice, that you can read 5 or 10 articles and make up your mind. You actually get the answer. So this is a very new environment. And the second big change in comparison to search engines or social media, as it was in the last 20 years, is the relationship between chatbots and the user. It is becoming very personal. And in that sense, it's much closer to what's happening between a user and a private chat such as WhatsApp or Telegram or Signal, rather than the relationship between the user and traditional search engines such as Google or any search you would conduct on Facebook or on Twitter or X. So that is changing as well. And that sort of intimacy of that relationship makes it even more complicated, because we simply don't know, and we are not able to replicate the answers that people are getting to their questions on chatbots. So the key takeaways when we in this sort of information space think about AI and the impact of AI on information landscape is it's changing rapidly. This is a change that is similar to what happened when Google was launched in 1998, and the old search engine based on catalogs such as Yahoo search were almost immediately replaced by the new, better product that was namely PageRank based Google search engine. And secondly, there's no way we can stop this. It is here to stay. And if you look at how creatively people are engaging with AI, and for how many people already it is becoming the main source of information, this is the place where they go to educate themselves, and how easy it is. But also the reaction of Google, Facebook, and other big players in this space, it is all going in that direction. And there's a prediction that about 90% of online content will be AI generated very soon, in fact, in 2026. So you remember when I was telling you about this democratization of misinformation, it essentially means that we will have more actors producing misinformation because it will be much, much easier for them. And essentially, if this prediction becomes reality, we could assume that 90% of online misinformation, just like correct information, will be AI generated in 2026. So what could we be doing as professionals working in healthcare? So at this stage, we have two recommendations here. First of all, the healthcare professionals and healthcare providers should educate themselves about limitations of AI, and especially when it comes to those conversations that you're having with patients. So for the last 20 years, I think we did a lot of work how to deal with patients who come to talk to doctors, and they were educating themselves using Dr. Google. We need to take a similar approach and educate ourselves how to deal with patients who come with solutions and answers already based on AI research that they conducted. And secondly, the public needs to be educated on the risk associated with AI-generated information. And it's not just communication specialists that can do that. That needs to come from healthcare professionals, and this educational work needs to start immediately, especially with that prediction that in 2026, 90% of the online content might be online generated. Thank you so much. Very happy to take your questions.
Well, thank you, Simon. That's a great presentation with a lot of thought-provoking statements and kind of a green outlook, but also with great solutions. So I think will be very engaging discussion at the end. So we'll move to our next speaker, and Ricardo will focus a little bit more on regulation and helping governments to address AI challenges.
Hello, my name is Ricardo Baptista-Leite, and I am the CEO at Health AI, the global agency for responsible artificial intelligence in health, a global agency based in Geneva with a nonprofit mission of helping the world build a global regulatory ecosystem to foster innovation and accelerate equitable access to AI-driven technologies that can lead to better health outcomes for all. And it is in that capacity that I am very grateful to André Para-Alta-Santos for his kind invitation to be with you today at this UFA Nova University joint session on artificial intelligence in healthcare. And I'm very sorry I could not be there in person due to prior commitments, but I hope to contribute to this debate, and I greet also my fellow panelists with this brief presentation. So I'm going to share with you some slides to discuss precisely what was requested from me around the topic of regulation of artificial intelligence in the field of health and looking at the landscape and what to expect in the future. And, you know, I'm a medical doctor trained in infectious diseases. I was in Parliament for 4 terms in Portugal. I was deputy mayor in my hometown. I'm still a city councillor in Sintra. And one would ask, why am I involved in this field? And this is just a personal picture of me at around the age of 5 in a mainframe room, an IBM mainframe room, and my dad's work, who works in IT, and I've been highly influenced, and IT has been part of my life, as you can see, from a very young age. But looking at AI in healthcare, we are looking at a reality that is exploding in the sense that the market share, if in 2022 it was a little over $10 billion US, we're talking about nearly $500 billion market value. It may be even more in 80 years from now, in 2032. And we're seeing startups popping up everywhere, or should I say, in the usual countries and usual suspects, in the sense of North America, Southeast Asia, and the Asia-Pacific region. There are probably many more than we can see here in China, and we'll see that in a second. And of course, Europe playing a role which is not as impactful as these other regions, but also playing an important role. But going just back to this slide to highlight that low and middle income countries are almost absent from this, this map in terms of presence of technology companies and startups, which goes to show that artificial intelligence, which has been proclaimed as the potential great equalizer of our time, making sure that everyone has access to technology. Well, in reality, we may be actually seeing, if we do not get the ecosystem right, we may be actually seeing a reality in which AI becomes the greatest divider of our time. That's the fascinating thing. We are early in the game, so it really depends on us to get this right. And looking at the number of patents, we can see the important role that the US and China are playing, but also the doubling of patents year on year. And this is expected to grow. And so we are clearly in a wave that has a transformative role in every realm of society, including healthcare. And if we see the top 10 trends of AI in healthcare, we see that last year, almost every area of healthcare was affected, from healthcare analytics to diagnostics to treatments to public health, population management to cybersecurity and personalized healthcare. And we see all of the big players like Google, Microsoft, Apple, Amazon that are here, all investing heavily in the field of artificial intelligence and health. And you can see, for example, that almost all of them are investing in what we call virtual scribes, which are basically virtual assistants that in a way can potentially take the computer out of the doctor's office, and with your virtual Alexa or Siri, you can collect information that is discussed, and the AI models can actually summarize the information, can come up with next steps, prescription of meds, prescription of diagnostic tests, and so forth. And there are rumors, I don't know if by the day of our session, it'll be confirmed that Apple and OpenAI with their ChatGPT newly announced 4.0 model are joining efforts. If this is true, this will be a tremendous accelerator of the idea of personal assistance, taking the concept of what Apple calls Siri to a whole new level of conversational capacity and the capacity to use video, for example, to interpret emotions, which raises a lot of issues that I won't get into right here. But the truth is, at Health AI, when we conducted a survey to governments, technology companies, patient organizations, the most common word we heard was the word fear. And this is a word that was related naturally to artificial intelligence and health. And that fear is stemmed from the lack of understanding of the technology, fear of its potential harm. And this is something that one can say is dependent in reality of also the hype that is created by the media, although there are risks that we cannot ignore. And also there's a fear that stems from not knowing how to address those challenges. But today, AI is already being widely used in diagnostic support, for example, with medical images. We're seeing AI used for tailored treatment plans based on individual genetic profiles, lifestyle, and clinical history. Predictive analytics is used in hospital management, for example, determining how many hospital beds need to be available on each day based on predictive models, for example, or managing the waiting lists. And also, we're seeing more and more patient monitoring and care. So patients that don't have to stay in the hospital and can be monitored from their own home. Looking into the future, population health management will become almost certainly a very important component of the application of AI, helping us transform the current disease-driven model towards a model that is focused on quality of life and well-being, preventing diseases that are preventable and detecting diseases early on that today we are detecting too late with worse prognosis and higher costs, understanding the environments in which people are living, understanding the different determinants of health and acting upon that information. Accelerated diagnostic, drugs discovery, where we are accelerating the process through predicting molecular behavior, which will allow us to cut time and costs, bringing new molecules, new pharmaceutical products to the market much faster to respond to specific needs. Augmented reality for training purposes, for example, where using augmented reality, we can simulate a surgical activity, for example, which will certainly support those learning before getting into an operating room. But also within the operating room, AI-assisted surgery is going to be more and more relevant, especially with the rise of robotics aligned with artificial intelligence. And finally, the role of virtual assistants, which I've already discussed before. And I'll leave you with this slide. I won't get into details, but it just goes to show that AI will be present across the whole health value chain. And the primary benefit will either be for better outcomes in terms of health outcomes, or for cost savings, or a combination of both. But what I want to highlight with this slide is we are dealing with such a transformational technology that we should use this opportunity to not do what we are seeing is happening today, which is organizations, health systems, companies trying to retrofit AI into the existing health model, into the existing health system. But why don't we use this transformational technology to rethink the health system, as if we didn't have hospitals and clinics as they exist today? And how would we design a health system of the future now that we have this technology, and help us evolve towards maximizing the benefit that this technology can bring to citizens and patients? But this is happening at the same time that we're seeing a rise of highly fragmented regulatory landscape. And this is something that is very concerning. You know, the EU Act is, of course, very well known in our context, but also the executive order from President Biden. The UK launched their AI Safety Summit late last year. France will be doing the next one. And everyone is taking their own stab at how to regulate the artificial intelligence. Well, not everyone. In reality, some of the richer countries in the world. Many countries today, especially in low and middle income countries, have no type of regulation, have no capacity within their regulatory bodies, and so don't have sometimes even professionals that understand the technology or are trained with the competencies that are needed to deal with AI. And so if that is not fixed, those countries will be constantly left behind. But going back to the EU Act, which was approved just recently and will probably be enacted over the next couple of years, the truth is it is a risk-based model, which is a bit different than what we're seeing the FDA do, for example, in the United States, where they're assessing software as a medical device. In this risk-based model that the European Union is following, it understands the risks. Sometimes there are concerns that, given the sensitivity of health, almost everything falls within the risk category, and that may hold back access to technology. And on the other hand, it's a fragile proposition, in the sense that we know that throughout the legislative process in the European Parliament, when large language models were considered to be low risk until ChatGPT was put into the market. And all of a sudden, that was low risk was transformed in law into high risk. We don't know what is going to come up next when it comes to AI. And so we possibly need to evolve the way we address legislation towards making legislation less strict, lighter, if you will, and giving more power to regulators to keep up to pace with the technology, and empowering them to be able to adapt as technology evolves. And so right now we're living this Wild West in most countries, where technology with AI embedded is being used with no oversight. And so the fast-paced technologies is probably one of the biggest challenges we're facing. This fragmentation is something that needs to be addressed. Global harmonization towards having at least a minimum bar of understanding of what regulation should look like will be critical if we want everyone to benefit, and if we want to accelerate AI technologies in healthcare in a way that is equitable and reaches the populations in need. We need to ensure that data safety, security, and privacy are taken into account. And a very important topic is post-market surveillance, making sure that we are putting monitoring of safety and effectiveness of these AI tools in place. And in many cases, there is really no post-market surveillance happening in our health systems. And that's what at Healthy Ag we're trying to address, which is basically trying to fix this lack of effective governance, which we know increases risks for citizens and systems, And when there are more risks, this leads to lack of trust and slow adoption of responsible AI solutions that we know can lead to better health outcomes. And that's why we believe that we need to address governance. And to do that, we looked into the history of technologies in healthcare, and we saw the example of thalidomide as an anti-vomiting drug that was given to women, pregnant women in the 1950s to deal with the nausea related to pregnancy. The issue is that at that time, in many countries, there was no regulation, and these drugs were used freely, and that led to more than 10,000 babies being born with birth defects. But the silver lining of this global health tragedy was that it led to regulation of pharmaceutical products. And today, 70 years later, nobody questions what is a randomized clinical trial, or what is market access authorization, or health technology assessment. These are all terms that have become accepted. And when we look at the machine learning lifecycle, we understand that from a regulatory perspective, all the way from the way we gather data to the way we develop the training models and the algorithms towards the deployment of the technology, and after we deploy the technology into the market, we need to have clarity on how we're going to regulate all of those components. And so when computers deal with our health, who's going to deal with the computers? That's where Health AI as a global agency steps in. And so basically, we are this agency that is in between. We are an implementing partner for organizations like WHO, like the World Health Organization, who is a partner of ours. And as you can see on this slide, we're in the middle as an implementing partner. On the left side, you have the normative standard setting organizations that are the ones that are responsible for developing standards. And so that includes WHO, OECD, and others. And on the right side, you have the regulatory bodies that are responsible for validating AI tools. And we are in between in the sense that we interpret, help translate, and adapt those standards to the local context. And we provide technical assistance and capacity building within countries to support governments to build the capacity to make sure that they have certified regulatory bodies capable of validating AI tools. So basically, our strategy is built on four main outputs. One is exactly what I just said, ensuring that you have validation mechanisms on responsible AI for health. As soon as we have several Health AI certified regulatory bodies, we will be connecting them into one global regulatory network. And this will allow knowledge sharing, data sharing, but also we are very excited to put together a post-market surveillance mechanism in place where a global early warning system will allow us to detect potential risks before they have greater impact. And if we detect a technology with AI that has the potential to cause harm in Indonesia or Brazil or Switzerland, we can raise a red flag to every regulatory agency around the world so that between the regulatory network and the technology companies, we can find technological solutions. And with WHO, we aim to build a global public repository of validated AI solutions for health, which basically will be a database online where that will be fed by the regulators. So as regulators validate tools, those tools will pop up and appear in this repository. So we'll be able to see at any given time what technologies are out there, who developed them, and which regulators have already validated them. And we will be also in a position to be able to provide advisory support to multilateral organizations, private companies, governments, and so forth. And underlying all of this, we decided to create the Health AI Community of Practice, which is focused on the regulation of artificial intelligence in health. And any institution, academia, multilateral, governmental, regulators, technology companies, private sector, everyone is welcome to apply. And you have the QR code here to apply to our community of practice. And the idea is to have a sounding board with all stakeholders to make sure that the way we build this regulatory ecosystem in the future reflects the needs and the visions of those who are on the ground, so that actually we are capable of creating an ecosystem that is adapted to the reality and can accelerate equitable access to these technologies, leading to better health outcomes for all. And that's what we're trying to do here. We know the potential of AI to save lives. We believe that to do that, we just need to get the regulations right. And if we do that together, we can achieve better health for all in the future. Thank you very much for your attention.
Thank you, Ricardo, and thank you for your kindness to share your video with us. So we come to an end to the presentations. So I encourage you all to post your questions in the comment section. So we have now we are running a little bit behind. So we have around 10 15 minutes for questions from the audience. So once again, I encourage you to post your questions online. And I would ask Ricardo if you could bring all the panelists to the stage. Okay. So the first question is to Anna around the kind of threats of AI to education, and one of the threats it's I'm sorry. Actually, it's about the potential impact on low and middle income countries. We can speak about the threats like plagiarism as well, but this one it's more about the opportunities and the opportunities for low resource settings, especially low and middle income countries. What do you think are the most promising opportunities for these countries around medical education and healthcare professionals? Anna?
Yes. So thank you very much. I can read the question on the slide, which I think is a very relevant question, because apart from what we said of potential benefits and the potential that AI has in improving medical education, true thing is that the evidence on impact, as our colleague was asking, is scant and lacking, especially evidence on true impact in low and middle income countries. So I think, although we've been discussing in my presentations and also in the presentations that we listened to the great potential, if we had to be honest, we should say that evidence on access and evidence on impact of AI-based interventions, especially in certain settings, is still very scant and lacking. And so we have to be very cautious in highlighting the potential benefits until we have some evidence and also some resources to bring AI solutions in those contexts.
Thank you. Thank you, Anna. And so we have another question, but let me get back to you again. You mentioned in your presentation that you were trying to implement already some AI tools for medical education in your university. If you could expand a little bit on that, and I'll provide you my feedback as a professor as well. So most of the times, the feedback from my other colleagues, they encourage students to use AI, like all the commercial tools available. But what they evaluate, it's actually the prompt, not the result or the answer. They to evaluate the reasoning of the students that they engage with the AI assistant. Can you elaborate a little bit of what you are trying to do at your university?
Yes, I think you're absolutely right. And the feedback you bring to the discussion from your colleagues in Portuguese universities aligns very much with our experience here. So what we do here is try to provide students with some, commercially available tools to support learning, presenting them as a complementary tools, as complementary instruments, complementary tools to support their learning path, but keeping traditional and solid, traditional tools as the main source of education. The second thing that we're trying to do is which is kind of different thing, teach them AI within medical curriculum, which is a different thing. And it's still at an early stages, and we are able to do that thanks to the expertise that AI people outside the medical thing within the university bring into the medical school. But I mean, a short answer to your question would be, we're trying to provide tools to support their learning, but also collecting data on the use and on their experiences that those students have in accessing those tools that we present as complementary tools, number one. And number two, we are trying to teach them AI-based tools for their future professional life within medical curricula.
Well, thank you. That's a good segue to bridge to Simon. Simon, during your presentation, you mentioned that one of the pathways to deal with the increased misinformation would be to help to educate the next generation of healthcare professionals. So can you elaborate a little bit on that, but also, and this question from the audience, you seemed a little bit skeptic of the future, I would say. Let me know if I misinterpret your sentiment. But where would you lay the responsibility on providing regulation on misinformation? More on the company side or the government side? Back to you, Simon.
Thank you. I think I'm being very realistic when it comes to this, and having worked with misinformation for the last 15 years, I think making relatively good predictions as what potentially could happen. I think responsibility will be very much on the government side, but not in the space that everyone might think of. I think we way too slow when it comes to regulation. What we're regulating today is basically what happened in 2020 or 2022. And once the regulation is there, say in 2025, we'll be already too late. We'll be regulating all news, old stories. So what we recommending, and this is the sort of educate the society approach, to treat misinformation exactly the same way as you would treat a virus. There was a pandemic, we're saying this is an infodemic, and we should be dealing with infodemic the same way as we dealt with the virus. So there are two approaches here. Once you could have a vaccine, and on the other side, you could have lockdowns. So what we're saying, let's vaccinate populations against misinformation. So that basically goes back to my point about education. We need to start very early in schools. We need to teach kids critical thinking. We need to teach them about online safety, how to identify fake news. And we're already seeing that some countries, look at Scandinavian countries, they're doing that really, really well. And that works. If we're going to take this sort of heavy regulation on platforms, this is what I call a sort of lockdown approach. So obviously there will be, they will stick to the regulation, but as a result of that, we're going to have endless discussions about freedom of speech and things that we value in the Western societies very, very much. So I think the sort of long-term, the best approach to this, yes, regulate, yes, it's policymakers, it's lawmakers, but not necessarily so heavily in the space of regulation of platforms or AI. So because of the speed of the changes, but way more impact on educating our societies and sort of vaccinating everyone against misinformation, either produced by social media, on social media, or produced AI. That's irrelevant. Misinformation is misinformation, and we need to sort of vaccinate populations against it approach. That's my take on this.
No, thank you. That's super interesting. Let me push you a little bit. So on the commercial side, we have seen several major companies trying to foster what they called AI alignments, a set of rules kind of to mimic our social norms. Do you think that's a way to go? And do you think, because I think misinformation could hurt the commercial sector as well. So are you optimistic that new tools will be developed to deal with misinformation?
I'm pretty sure there will be developed, and looking at the amount of work that has been done in this space, no doubts about that. The problem with this approach, basically, sort of the alignment approach here, is that what is good or bad in one country, or what is considered ethical or not ethical in one country, it's not necessarily the case in other countries. We saw a lot of that during COVID pandemic, that it was absolutely acceptable to say one thing, say in Britain, and it wouldn't be acceptable in other parts of the world. So having those systems and basically based on the set of rules, I'm guessing would be the sort of Western rules. It makes we're going to be facing the risk that they might not be seen as ethical or actually good in some other countries, and that might give us a lot of problems there. Basically, the answer is, in short, is the cultural context here will play a huge role, and already we're seeing that a lot of countries from down south are raising voices that the technology is imposing Western values, and their values are not being taken into considerations. When we're thinking about ethics and teaching AI of the ethics, we need to make sure that all values are equally represented, and that is very difficult.
Well, thank you. I think we are coming to an end. We don't have any more questions. I think we addressed them all broadly. I think we have very interesting discussions, so don't stay with us for the quiz and the prizes. But I would like to wrap up thanking all the speakers, Ana Odon, Simon Piatek, and Ricardo Batista Leite for their time and very thoughtful conversations. And I would like to thank also Dimitra Pantelli and Catherine Paulin for helping to reach out to speakers. So thank you, and thank you to Ricardo for organizing this webinar. It was a real pleasure to be moderating, and see you in Lisbon.
Thank you.
Thank you, Andre. Thank you, Anna and Simon, and also thank you to Ricardo, who couldn't be here today with us, but still also a very interesting presentation to us all. So it was a wonderful webinar, and we're now reaching the end. And as you know, on all webinars, we have the quiz. I'll invite you to join. So there's on the banner that's running below, you can find the link to access the quiz. And I'd like to highlight that there's a significant delay between the video, the stream that you're watching, and the actual quiz. So we would advise you to use either a mobile or a different device to answer the questions on the quiz, because it's faster that way. So we'll now allow for some minutes for people to join our quiz, the platform. So here you have the link that you should access to join the quiz. So we'll just allow for a couple more minutes so that you can join, and then we'll have the questions afterwards. I would highlight that we have this monthly webinar, and you're welcome to join us for the next session. Stay tuned in the website of the European Public Health Conference, where you can also look at the videos from the previous webinars. So far we've had a significant number of very interesting presentations. So if you want to review them or see them for the first time, do go to the conference website and access them. You can also access the different recordings in the different social media. So either on LinkedIn, on Facebook, on YouTube, and also in Facebook, LinkedIn, X, and YouTube. So we now have already 16 participants online, 17. I'll give you just 30 more seconds so you can join, and then we'll start with the quiz. I remind you that we'll have both. Today we'll give a prize, so an invitation for the dinner and dance in Lisbon for at the conference, and overall the overall winner will have registration for the conference in November. So a waiver of the fee for the conference in November. So let's start with the session, and good luck to all participants. Remember that being fast to answer is also awards you more points. So don't forget to do that if you know the answer. Okay, so let's start. So first question: how can artificial intelligence be applied to train the next generation of healthcare professionals? Is it through content generation, personalized learning platforms, virtual patient simulators, all of the above? Okay, let's see the answers. So everybody answered correctly. So indeed, those are all the options above. Let's go towards the next question. Oh, before we have the leaderboard. So the fastest to answer was, I guess, Patricia. Maybe that's a misspelled name. Then Anna, then Luciana, Elizabeth, and Maria. So next question. When using artificial intelligence in education, which of the following considerations should not be taken into account? Addressing bias in AI algorithms, promoting the work of AI experts only, addressing the AI's black box, or collecting quality evidence? Let's see the answers. Yes, indeed, most participants answered correctly, promoting the work of AI experts only. So we should use the other options as well. So let's see what the outcome was. Let's see the results. So now we see Elizabeth jumping to the first spot, Patricia in second, and Rafael in third. Next question. Which measure is most effective in preventing the propagation of misinformation by AI in healthcare? Is it enhancing the graphical interface of AI systems, increasing the number of AI systems in operation, integrating diverse data sources during AI training, or reducing the interaction between AI systems and healthcare providers? And the answer is integrating diverse data sources during AI training. So most participants also answered correctly. Next question. Oh, let's see. So Elizabeth is on the 3 correct answers, and she's leading the board. Patricia is close second, and Rafael in third. Let's see the next. Which strategy can help mitigate the risk of misinformation spread by AI in healthcare? Is it increasing the use of AI in diagnostic processes, decreasing transparency in AI decision-making, educating healthcare providers on AI capabilities and limitations, or limiting AI use to administrative tasks? And the answers are educating healthcare providers on AI capabilities and limitations. So also, most participants answered correctly. Elizabeth is still leading, but now the distance between her and the next participant, Diogo, is now in second, and Nana in third. Let's see what the next question brings. How many participants did we have at the first UFA conference in 1992? Is it 115, 216, 345, or 56? And the correct answer is 216. We have 6 correct answers. Let's see the next, the leaderboard. So Elizabeth is also on the first spot, Diogo in seconds, Valentina in third, and Paulo in fourth. 6th question. When did the European Journal of Public Health become fully open access? Was it 2000? Was it 2010? Was it 2017 or 2022? So most participants have already filled in their answers. Let's see the correct answer. Indeed, it's 2022, and therefore only 3 people answered. So this might provide a shift in the leaderboard. But Elizabeth is still going strong. Now she has really roughly 100 points in front of Diogo, and Valentina in third, and Paulo in fourth. Let's see the next question. What is the link between EUFA and the European Journal of Public Health? Is it the European Journal of Public Health started EUFA? EUFA publishes the European Journal of Public Health. EUFA owns the European Journal of Public Health, or there's no link between them. So let's see the answers. Well, most people thought EUFA publishes the European Journal of Public Health, but in fact, it owns the European Journal of Public Health. Let's see the answers now. So now Paulo is moving back up to the third spot, and Elizabeth is still in first, and Diogo in second. Next question, so we're halfway through the quiz. Which organization hosts the Brussels EUFA office? Is it ASFER, is it IFA, is it EMA, or EuroHealthNet? Let's see the answer. It's EMA, not IFA, as most people thought. So let's see the results. So now everything is becoming really close, but Elizabeth is still in the lead. Let's see the next question. Question number 9. How do we call theme-specific groups within EUFA? This is an easy one. Working groups, advisory groups, sections, or thematic areas? Only 3 seconds to go. And let's see the answer. Yes, there are sections. And we actually had a president of a section. Anna O'Donnell is the president of the digital health section. So 7 people answered correctly. Let's see how it impacts the leaderboard. Anna Tietjen is now closing in on Elizabeth, and she's now in second place. Diogo third, and Paulo is in fourth place. But Elizabeth is still holding her leadership. Next question. Who was the very first president of EUFA? Was it Martin McKee? Was it Iveta Nagyova? Was it Louise Gunning-Scheppers or Peter Alabek? Let's see. Oh, most people answered either Martin or Peter, but in fact, the first president was Louise Gunning-Scheppers. Let's see the 2 people that answered correctly. So Paul is now in the lead. So he's moved up from 4th to 1st place, Elizabeth in 2nd, Anna Tietjen in 3rd, and Diogo in the 4th place. 11th question. How many sections exist in 2023? Is it 10, 29, 22, or 26? Let's see the answers. Actually, it's 29, only 1 correct answer. Let's see if this shifts the leadership. Okay, Patricia is now back in the 4th place, but Paulo is still holding on in the 1st place. 12th question, you were nearing the end. Lisbon's iconic Santa Justa lift is a popular attraction, offering panoramic views of the city. Who was the architect that designed the elevator? Was it Gustavo Eiffel, Antoni Gaudi, Ricardo Velázquez Bosco, or Raúl Mesni de Ponsard? And this is a tricky question, even for people who are from Lisbon, because most answered Gustavo Eiffel, but in fact, nobody answered correctly. So it was Raúl Mesni de Ponsard. So now no change in the leaderboard. Let's go to the next question, only 3 to go. Lisbon is known for its vibrant cultural scene, including an annual festival and events. Which festival celebrated in June marks the patron saint of Lisbon, with significant parties, music, and sardine grilling? Is it Santo António, São João, São Pedro, or São Vicente? This is an easy one. So it's Santo António festival. And let's see the impact on the answers. Okay, Paulo is in the lead. Then it's Patricia, Anna, and Diogo in 4th place. And Elizabeth has been silent. I don't know if she logged off, but she hasn't answered the latest question. So let's see what happens in the last 2 questions. How many abstracts did we have submitted for this year's conference? Was it through 3,055, 3,555, 2,505, or 2,905? Yep, that's 3,055, and we're very proud of this very record high number. And we understand this will have an impact on the acceptance rate, but we're very happy to host all this quality work that will be presented in Lisbon. So now, there's a change in leadership. So Diogo is now in first place, only 3 points ahead of Anna. Paulo is third with 607 points, then Elizabeth, and then Patricia. So let's see what happens in the final question. It's really neck and neck for the first two. One of the pre-conferences of the European Public Health is the Lusophone Public Health Conference. How many countries are part of the community of Portuguese-speaking countries? Is it 8, 9, 10, or 7? Let's see the answers. Yeah, most people answered 9. And let's see what happened to the leaderboard. Okay. Diogo is the winner. So congratulations, Diogo. You've just won an entrance for the dinner and dance in Lisbon. So congratulations on this victory. And of course, all the points of the participants are now being collected for the overall winner that we'll announce at the last webinar. So now let's spin the wheel. So besides the winner, so the person who has the highest number of correct answers and fastest answers, we also draft a ticket for one of the participants in the quiz. So let's spin the wheel and see who's the winner for today. Oh. And it's Paulo. Congratulations, Paulo. Paulo was also one of the first placed in the ranking. So congratulations, you also won an entrance to the dinner and dance in Lisbon. Congratulations, Paulo. And last but not least, we'd like to ask you to fill in this word cloud on what word you would use to describe today's webinar on artificial intelligence. So I'll give you eventually a minute so that you can do that. Okay, technology, entertainment, future and present. That's curious. Innovative, insightful, futuristic. Okay. I'll just give you a few more seconds so that people can finish their input. Okay, so innovative and insightful, as well as interesting, are the words that are most often mentioned by our participants. So thank you so much, everyone. We are very happy to host this webinar and also for the prizes that we have awarded. Stay tuned for the next webinars. Look up the European Public Health Conference's website, so that's rolling in the banner. And we'll be looking forward to see you in the next webinar. And also, I'd like to take the opportunity to highlight something. The conference in Lisbon will take place at the same time as the Web Summit, which is a big tech conference. So accommodation will be on high demand during that week. Therefore, if you're planning to come to Lisbon, and we hope you are, do book in advance your accommodation, because it will be difficult to find accommodation in November in Lisbon. So all the best to you all. Thank you so much for watching. Stay tuned with the European Public Health Conference social media, and I'll see you in the next webinar. Thank you so much and have a great weekend.